Yeah, anyway, very good afternoon and start now. Now, last class, if you remember, we started a very interesting remedy. Which was that remedy? Kreosotum. Very good, good. Uh, any quick questions in Kreosotum? Anything you would like to ask? Any confusion? Anything that you are not clear with? All of you have read Kreosotum? Okay. So, if you have read, then what we have tried to do, probably this is where, if you remember, we had stopped. I spoke to you about the characteristic symptoms. Okay. Now we'll go ahead and we'll see what I have planned for today. A small recall of what we had already done in Kreosotum in the last class. Okay. See, we spoke of pathogenesis, and I also gave you the sphere of action. Correct. Now these headings are very important to understand today's class. Okay, because it is all interlinked. Done. So first thing is we spoke of pathogenesis, and second we also spoke of ailments from, and third we spoke of characteristic symptoms, and we also spoke of diathesis. Fine. A quick recall, 2-3 minutes of all the four headings. A quick recall of all the four headings. So under pathogenesis, what did you see? What is it? Mucous membrane, okay, blood vessels, skin, and of course the GI and female, yeah, glands and lymphatic glands. That's where we had that acrid and offensive discharges. Okay, that was very important. Ailments from dentition. Okay, yeah. Fine. So one thing was dentition, absolutely right. Bad smell, sprains, good. Only 3? Okay, chalo, good. Diathesis, hemorrhages. And last thing we spoke was characteristic symptoms. What was characteristic? Discharges which were offensive, excoriating, acrid, and discharges which corrodes. Good. The symptoms, yes, very good. The symptoms which progress rapidly. Good. We spoke of desires. We also spoke of offensivity. So people who have slept can, yeah. Anyway, offensive discharges, and we also spoke of cancerous affections. And urination, there was something very, very peculiar. See, this is a contradictory and a very characteristic symptom in Kreosotum. There was one more characteristic symptom. Menses only on lying down. When they start sitting, moving around, it stops. Good. Now this knowledge is very, very important. And this is what we will be applying in today's class. And I feel it will be a beautiful class. It will be a very interactive class, because all these things are related, and our class is built on these 4 factors. Okay. Now before we go ahead, what I was trying to tell you is, what are I planned for next 40 minutes? What am I going to do? Okay. Naturally we are trying to explore Kreosotum. The remaining part of Kreosotum is what we are looking at. Okay. Now we are looking at the mind, the mentals, and then we are also looking at the particular symptoms. Particular symptoms, I am typically not going from head to toe. Okay, it will take a lot of time. So what I have done is, keeping the third year in mind and the future that you will be a practitioner, what is important is what I have tried to take it. So what you will see is, we will be speaking in length about the GIT. We will also talk about the urinary symptoms, and of course I will put a heading, miscellaneous. Under miscellaneous we will discuss female affections, we will discuss cancer, we will also discuss skin, we will discuss modalities, and we will conclude with the clinical utility of Kreosotum. Okay. There are a lot of things to discuss. So hope 40 minutes I feel we can do justice to this beautiful remedy, Kreosotum. Okay. So now first thing we'll talk about is the mind of creosote. Mentors. Okay. See, you need to understand creosote is a carbon. Okay. We discussed, that was the first introductory thing I did. We have carbohydrates, graphites, carboanimalus, petroleum, and of course creosote. Okay. So what you see common to all those carbons is what you also see in creosote. Have you gone through the generalities of carbons? You have a video which is already uploaded. There I have spoken about the carbon mind in general. In case if you have not seen, no issues, we will try to understand. See, first thing, a carbon generally we say is they are very slow. Majority of the carbons are slow. Carbohydrates, carboanimalus, graphites. But this is the only carbon which is rapid, which is fast, which is rapid. So what you see under the mind in creosote is they are very restless. Children or adults who are very, very restless, they can't sit in a place. Okay. So what is that restlessness you have in creosote? Restlessness in children, especially at night. Restlessness which also comes during dentition. We have already discussed this. And children are a creosote person, out of restlessness they keep moving constantly. Restless, they can't sit in a place. Restlessness is more at night. Restlessness during dentition, and restlessness where they have to keep moving around. First point. And second very important thing, we have already, this is something new and nice in creosote. Again, something peculiar to carbons. Carbons like carbohydrates, graphites, they are the kind of constitution, they will not like to be touched. They will not like to be consoled. Am I clear? Okay. So they will not like to be consoled, they will not like to be touched. Creosote is the only carbon which likes being caressed. Now what do you understand by being caressed, being fondled? It's a gentle touch. Okay. It could be like, for example, see, if you look at this, it might have two extreme meaning. Mother, child, husband, wife, boy, girl, the meanings can vary. But what you need to understand is, but the feelings will be different. When you talk about mother and child, okay, mother caressing the child, fine. You would have seen the cow and calf. When the calf is feeding, what is the cow doing? Yeah, like it's licking and all. See, that could be a simple example of caressing. Similarly, you see the mother, like for example, moving her hand gently over the baby, or for example, touching his hair, or passing her fingers into the hair. This is what we call it as being caressed or being fondled. Okay. So creosote is the only carbon which likes that touch, which likes being caressed. Okay. So what your books give is restless. See, children are very restless at night. You already know that. So what they expect is they want their mother. They want their mother next to them, and they want her to caress or fondle them. Only then they get sleep. You are having a clarity about the symptom? Fine. So once that caressing feeling or wants to be fondled is very important in creosote. Okay. And a beautiful symptom you have in creosote. Now what do you understand from the image that I have taken from Google images? That you see mother trying to convince something and the child is not at all interested, obstinate, stubborn, etc. But what I want to tell you in creosote is, we had a symptom in Sina, we also had a symptom in chamomilla. Very good. Capricious. What is capricious? They want something. When offered, they reject. Okay. Okay, done. So like for example, you have this small boy, small girl. They would have gone into a toy shop. They would have purchased something. They have not left the toy shop. Then the girl sees some other toy and she says, no, I don't want this, now I want that toy. Fine. And this could be a classical example. Now capricious is what you also have in Kreosotum. Capricious will have two things. One, there is no consistency in the mind. The child does not know what exactly it wants. At the same time, the child is stubborn. Inconsistency and obstinacy are two important components of capriciousness. Okay? So you want something, you have purchased, 2 minutes, 3 minutes, you are fed up and you want something new, capricious. Okay? Now what remedies come to your mind? Chamomilla, Sina, and there are few more remedies. As a third year student, Rheum is a final year remedy. Rheum, R-H-E-U-M, Rheum. One more remedy is Stephysagria, which is your a remedy from your syllabus. 3 top remedies. I am talking to you about the top remedies which have capriciousness. Chamomilla, Sina, Stephysagria, Rheum, Bryonia. You can also add Bryonia. Okay? So capricious. Now one more very important thing you see here is, these are the people or these are the constitution who are discontented, never satisfied. They are not satisfied with anything. Okay? People who are dissatisfied with everything. Very difficult to satisfy them. Kreosotum. Very difficult to satisfy them. Are the things clear in this slide? Okay. Capricious, we spoke of restlessness. We also spoke of they having a desire to be caressed and fondled. And of course the last symptom was dissatisfied or discontented. What are they discontented with? They are discontented with everything. Nothing can satisfy them. Kreosotum. Okay. So we'll go ahead and we'll say what else we have in Kreosotum. Now probably this is what I wanted here is, what is this? Carrying. Very good. Wants to be carried. Good. Very good. I am happy with your interpretation. What remedies come to your mind? Chamomilla, Sina. Fine. But what is the speciality in Sina? Wants to be carried, but carrying will not ameliorate. They want to be carried, but carrying will not ameliorate. And Sina and Chamomilla are also the kids, who keep changing from father to mother, mother to maid. Very restless kids. 3 minutes father is carrying, then she says Amma, Amma. Amma carries 2 minutes, then she is bored with Amma. And for example, maid is there, she might go to the maid, or again she might go to the dad. This is also a kind of capriciousness. Fine? Capriciousness, not necessarily a toy. Capriciousness is something that is happening in front of you, in front of your eyes. Don't miss it. That can also be capricious. Now, what do we have in Kreosotum? Desires or wants to be carried. You have a beautiful thing, wants to be carried and caressed. Try to understand. Hope I am clear. Sina, Chamomilla wants to be carried. Done. Now how is Kreosotum different from Sina and Chamomilla? Not only carrying, they want to be caressed or they want to be fondled. Okay. The only other remedy we have in our materia medica is pulsatilla. The only other remedy is pulsatilla. Carried and wants to be caressed and fondled. Done. Kreosotum and pulsatilla. Okay. Any confusion? You have all rights to stop me. I can clarify. Hope it's clear. Done. So the next thing what you also see here is Kreosotum is an angry child. Kreosotum is an angry child. Okay. Now anger, why do they get angry? Okay, more than contradicted, something very close to contradicted. When they want something and when you refuse to give it to them. See, they want this. You say, no, this is very precious, something like that. You don't give. So what they want, when that is refused, they get angry. You have only 4 remedies mentioned in your repertory. That's why creosote becomes something very important. Okay. So the other three remedies are, you have bryonia, chamomile and senna. Anger when things he wants are refused. Beautifully phrased. Anger when things he wants is refused. Okay. Now, how each child reacts in angry? How each child reacts when he is angry? Okay. Do you think all of us will react in the same way? How can I have some quick reactions? Okay, you might cry. Good. You might scold. Yeah, sit on the floor. You don't talk. You throw. And your friend is throwing. Okay, you throw. You don't talk. Doesn't eat. Hit. Hit. What is? Yeah, tearing the clothes. It could. Huh? Running away. Biting. Yes, good. Good. Huh? Become silent. Become silent. Fine. You want someone to come and console. Why are you angry? Your mother. Fine. She is like that only. Father is telling. Don't worry. She is like that only. Don't worry. Fine. So father and daughter, they become close for 2 minutes. They are happy. They come back. Okay, good. See, the reactions can be many. Done? Okay. Now you have given me many reactions. Now what is it trying to tell is each individual. See, the emotion is anger, but see how each of us are reacting in anger. Done? So that is what Dr. Honeyman emphasizes about individualization. Same emotion, how we react. Now how is creosote reacting? See, there are people who slam the door. You miss so many things. They break remotes, they break phones, they break their things. Or somebody rightly said they might hit themselves, they might bang their hand against wall. You see the repertory, you see the movies, you see your friends around. Each of us have our own way of reacting. Okay. In creosote, they throw things. In anger, a creosote child or a creosote patient throws things. Okay. Done? So we will move. Somebody was talking of rolling. Somebody rightly said. I don't know if I shared this case, but a beautiful case I wanted to share with you was Saturday. Today is Tuesday. Saturday we had a case of a mother who called me over phone. Sir, my child is having bad pain abdomen. 3.5 to 4 years old child with bad pain abdomen. Okay. And over phone I asked, what is he doing? Sir, he is rolling over the floor. See how beautifully the mother gave the symptom. I just asked her, what is he doing in anger? Sorry, in pain. Sir, in pain. So, sir, he is rolling around. And it's an emergency. I need to see you. Please, can I bring the child? I said, yeah, get the child. Emergency, don't, put up your price. So the child was brought into the clinic. And how do you solve this case? Simple case. I took 2 minutes, 3 minutes. You can also solve this case. What is that symptom you got? Why is he rolling? Where is the pain? Clear? So in your repertory, which somebody will teach you, under mind there is a rubric rolling. Okay? Rolling over floor, pain, abdomen in. Artha agta idea? Rolling over floor, pain, abdomen in or abdomen from. The only remedy that is given is arsenicum alb. My job became very easy. Okay, child also was very restless in clinic. A dose of arsenicum alb. And I did examine, I did not find anything. Like there could be a lot of questions that might come up in your mind as a third year student. Is it appendix? Is it this, that? Fine. Luckily, that McBurney's point, whatever, umbilicus, it was all fine. Okay. So a dose of arsenic was given, 200. And I asked the mother to get back after 1 hour, to call me after 1 hour. Any wild guess what happened after 1 hour? Huh? The child was deep asleep. The child was sleeping. Okay. We did not give medicines to put the child to sleep. Don't give the look. But what I am trying to tell was, child was comfortable. Comfortable to what extent? The child was sleeping. Fine, I told the mother, don't disturb the child. Please update me in the morning. And morning 9:30, 10, she leaves me a message on WhatsApp. Sir, child is absolutely fine. He wants jamun. He wants sweets, he wants jamun. What do I do? I said, give. Fine, you're getting my point. So, a simple case, somebody told of rolling and I thought I should share it with you. A single dose of arsenic mal 200 did wonders. So, what you see is what you can just take it. Huh? So, here in anger, the child is throwing things. Okay. See, not only anger, you have another extension here, shrieking. Shrieking is screaming, shouting. Okay. Any wild guess why do they shout in, or when do they shout in creosote? Very good. During dentition. Good. 1 point. So, shrieking during dentition. Shrieking before and during stools. Shrieking during dentition and shrieking before and during stools. Now, the last point I want to mention under creosote mind. None of you bothered to ask me a question. What was the question? Sir, the case you showed. The case, if you remember the case. What was the case? Case of an elderly man with eruptions over the fingertips. Okay. And why was creosote given? Yeah, good. What was that mental? What was that mental symptom? He did not have any of these things that I already mentioned. He was not capricious, he was not shrieking, fine. He was not angry, he was not throwing. But one beautiful symptom I told you. Huh? Okay, fine. See, he was not even dissatisfied. See, he had consulted allopathy, dermatologist, he had consulted Ayurveda, he had consulted my wife, homeopathy, and my wife referred him to me. So he has gone through a lot of doctors and he is suffering so much. I told you, so much of suffering that he is not able to eat, he is not able to wash, take bath, brush. You know the importance of these fingertips. He was not able to hold anything. So, you know what he had come up, he was not able to button his shirt. He was not able to remove his button. Everything he was dependent on his wife. And none of the homeopathic, allopathy, Ayurveda, none of it is helping. You know what this gentleman decided? One fine day he told, sir, he told me the same thing, his journey. So many dermatologists, Ayurveda, your wife, and ultimately you. I don't see any improvement anywhere. And sir, let me die. Okay. Now this is what you have in creosote. When you have a situation like this, creosote can do wonders. Now, what is that situation? Can somebody tell me why this gentleman wanted to end his life? Why he wanted to die? Because, excuse me, it's not because of pain. Because he wants to become dependent? No. See, he was hopeless. He was not seeing hope. Homeopathy, Ayurveda, allopathy, no hope. Okay. So there is a beautiful rubric mentioned in your repertory. Death desires, despair from. I'll repeat. Death desires, andre, I want to end my life. And why you want to end your life? Because there is no hope. Okay. Death desires from despair. Death desires from hopelessness. So many doctors have consulted, so many systems have consulted, but I don't see any hope. So that is the beautiful catch for you in creosote. To be very honest, I have not prescribed creosote on these symptoms till date. Okay, mind. But on this single symptom, I can share you some 10 to 12 cases, beautiful cases with creosote. I have a case of a lady with autoimmune hepatitis, SGOT, SGPT 1000 plus, etc. And she also had come to an extent, a level where she decided, sir, my husband has taken to the best hospitals, best allopathic hospitals, but there is no cure. Why should I live? Let me end my life. So this is the feeling you have. Death desires from despair, or death desires from hopelessness. Only remedy. Never miss. You will get this situation in grave diseases, in cancers you will get. Creosote may cure, may not cure, but at least once you give creosote, that this feeling will definitely go. You know, that's a beautiful thing. This feeling will go. I no more feel so, doctor. I see some hope. You know, something like that will come up after giving creosote. Okay? A beautiful symptom, don't miss. I have verified, I have used with wonderful results. Okay? Done? Okay, we'll go ahead. Mind is clear? Done. See, if it is clear, anyway, we'll have a revision in the end. Let me finish what I have planned for today. See, after mind, we decided we'll talk of GIT. And I personally feel you can start contributing. You go in a systematic order, you start with mouth. Go slow, I know you are all capable of answering. Just go with the anatomy, go with what we discussed, the pathogenesis, the diathesis, the characteristic symptoms and ailment, and see what creosote can produce or what creosote can cure under mouth. Okay, one at a time. Okay, one second. Somebody is talking of ulcers. Okay, I know. Ulcer is which miasm? Good. So you can have ulcers. Where do you have ulcers? Ulcers over the gums or ulcers in the mouth. What we call it as aphthous ulcers. Good, beautiful. I agree with it. Ulcers. Anything else that you can think of? Good. What made you think of bleeding gums? So it's a remedy for hemorrhagic diathesis. That's why time and again I keep telling, materia is a subject that should not be by-hearted. Materia is a subject that need to be understood and you need to apply. So the word hemorrhagic diathesis can bring in lot of symptoms in creosote. So there can be bleeding from gums, spongy gums, you know, gum bleeding, ulcers, two very important points. Good. Anything else? Huh? Very good. Your friend is talking of offensiveness. What made you think of offensiveness? So creosote is a trios of offensive remedies. So there can be offensiveness coming from the mouth. Okay. What could be offensive in creosote? Breath. Beautiful. Breath. Odor. What is it? Mouth odor. Okay. The odor from the mouth. We call it as halitosis. There can be offensive breath, offensive odor from the mouth. Beautiful. Good. Anything else? Decay. What gets decayed here? Teeth. Very good. That is the point. Decay of tooth as soon as it appears. How is it given in your books? Tooth turns black as soon as it appears. That is creosote. We had a child, you know, a small boy whom we were treating. I did not give him creosote, but I want to tell you these symptoms, they can come to your clinic. This boy had bad dental caries. Bad dental caries. Almost all his milk teeth, they have gone into caries. So there is a symptom or there is a rubric in your repertory. Teeth decay in children, and what is the next word we need to use? Premature. It is not as soon as. It is premature decay of teeth. That rubric was taken and he was given phosphorus. It's a different thing. But I want you to understand. In creosote, for example, 1 year, 11 months, 10 months, you know, the tooth is coming and tooth is turning black. It is a syphilitic remedy, and these things happen in a syphilitic manifestation. Okay. So I am happy with whatever you have tried to tell. One is dentitional issues. So tooth or tooth decay as soon as it appears. One thing. Second thing, we already saw during dentition, what will happen? The child is very restless. The child is shrieking, which we cranky, irritable, restless, and this is what I was trying to tell you. Decay. premature decay in creosote, and bleeding gums, you got it right, spongy gums, ulcers in the mouth, and yeah, saliva. We forgot this, only point we forgot was the saliva in creosote can also be offensive. The saliva in creosote can also be acrid. You know the discharges. Acrid, offensive saliva. And last thing what you saw was offensiveness, bad breath, bad breath. So this is related to mouth. Nothing much to do with throat, so we will directly talk of stomach. Yeah. Before I show you the PPT, what do you expect in the stomach in creosote? Very good. Ulcers? Huh? Very good. Hematemesis? Beautiful. Huh? Very good. CA of stomach? Good. Yeah, there's a point. Good. CA of stomach, ulcers, hematemesis. Anything else? Gastritis, indigestion. Very good. So, next we'll focus on stomach. And in stomach, what gets highlighted in creosote is nausea and vomiting. Nausea and vomiting. So there is nausea and vomiting. So when do they have nausea and vomiting? Or what is it that they vomit? See, nausea and vomiting immediately after eating or immediately after drinking. The moment they drink, the moment they eat, they vomit. That could be one situation. Then the second situation here is nausea or vomiting wherein they vomit undigested food. What is it? They vomit undigested food. See, food which is eaten several hours before. You know that? Food which is eaten several hours before. Meaning you would have eaten in the morning idli and you are vomiting at the night. So what are you vomiting? The same idli. Okay? And from your physiology, you know, 3 hours food empties into the intestine. So what you also need to understand here is there is indigestion, there is slow digestion. Okay, the digestive system is weak. So food which is eaten several hours before, that gets vomited. That gets vomited. Clear? Okay. Now yeah, this is what I was trying to tell you. Slow digestion, indigestion. And we also see that, as rightly mentioned by a few of your friends, it's a very important remedy for cancer. Important remedy for cancer. And cancer of stomach. Now one direct symptom that you see because of cancer of stomach is, you see bloody vomiting, hematemesis. Okay? Hematemesis. So this is what that can happen in creosote. One more thing I'll finish here is diarrhea. The diarrhea. Character of stools in creosote. One, you already know it is offensive. It can be dark, brown, bloody. It's a remedy for CA. It's a remedy for cancer. So you can see bloody stools. A remedy with hemorrhagic diathesis. So you can also see bloody stools. Stools which are bloody, offensive, fetid, dark brown. This is the diarrhea part. So under GA, we spoke of for the stomach symptoms, the mouth, yeah, and of course the stomach, and last was diarrhea, intestines. Okay. Now this is the urinary symptoms. Probably one or two you already know. What is the first symptom you have in creosote? Can urinate only on lying down. A very contradictory symptom. Okay, very contradictory symptom. That is one. And character of urine? Offensive. Offensive urine. Huh? No. Everything you can't put burning and all. Fine. Yes, offensive urine. Okay. Urine might burn. Agreed. It could be bloody. Yes, possible. It can be a remedy for CA bladder. Okay. Bloody urine. Hematuria. Possible. Now one thing I want to tell you here is, you have a beautiful situation. I'll just show you the image and please interpret this image. and if possible I'll try to share some cases here. Now this we already know. Kindly interpret this image. Very good. But see, don't split it. If you have to split it, I would have put two different images. I have tried to club both. What is the idea of clubbing both? Okay. So I'll give you a situation. We have beautiful remedies in homeopathic materia medica or in homeopathy for bedwetting. A very troubling, annoying problem for the child and the mother. Mother also has a big task. Okay, she has to clean all that thing. Now what is important, or what is that situation, or tomorrow when will one prescribe creosote in bedwetting? Okay, see what is that child tells you is, sir, uncle or auntie, whoever it is, I dream as if I am in the bathroom and I am urinating, and that is when I urinate. You are getting this point? So he assumes, or he is dreaming that he is in the bathroom passing urine, but where is he actually passing urine? He is passing on the bed, wetting the bed. Okay, so this is a beautiful symptom you have in creosote. There are some 10-12 remedies. Huh? Yeah, there are some 10-12 remedies. One more remedy you should think of in this situation is sepia. Sepia. Okay, sepia. One more remedy from your syllabus. I will talk of sepia, a beautiful remedy, must be in the next term. Beautiful remedy, it will take a lot of time. We will finish small remedies and then we will explore sepia. Okay, so we will get back here. Bedwetting. A question for you is, they dream of passing urine and then they wet the bed. Very important. Okay, and you know urine will be very offensive. Bedwetting during first sleep. Going back to your physiology, there is something called as first sleep and second sleep. So bedwetting which mainly happens during the first sleep. Okay. Enuresis wets the bed while urinating, while dreaming of urine. Very characteristic. Now this is also an area that you can contribute. Now what is this area we are trying to explore here is female. Now what do you have under female, or what can you expect under female? Very good. Leukorrhea, good. Leukorrhea, yeah, if you have to complete leukorrhea which is offensive, leukorrhea which is acrid, excoriate. See, naturally out of that acrid thing, what happens? There will be itching, irritation, excoriation. So acrid, offensive, excoriating leukorrhea, first symptom. Good. Then anything else you can think of? Menstruation or menstrual flow only on lying down. It ceases as soon as she sits or she is walking. Good. 2 points. Beautiful. Happy. Think anything else. As a third year gynec student, very good. Cancer of uterus, cancer of cervix, beautiful, good, agreed. Cancer of uterus, cancer of cervix, anything else you can think of? Huh? It's a hemorrhagic diathesis, remedy having hemorrhagic diathesis. So the menstrual flow can be excess, profuse, possible. Okay. Here you can also see that this we have already explored, so we will not look at this. Cancer of uterus, cancer of cervix, erosions, ulceration of cervix. Okay, you can think of that. This you told me. One last thing that you need to remember here is from the obstetrics, lochia, a discharge which generally happens after delivery. So lochia in creosote is offensive, acrid, lumpy, dark and brown. You will be posted to the obstetrical clinics or hospital. Okay, there you will get to see all these things. Lochia. Okay, so 4 points you need to focus: ulcers, cancer, and of course the other things that I mentioned. Clear? So before we jump to the next part, today we spoke of mind. We also spoke of JAT. Then we spoke of urinary, and of course we are talking of female genitalia. Last one or two points here is skin. Hope that's the next point. Yes, skin. Where do you think of creosote in skin affections? Okay, eruptions. See, now you need to understand. Creosote is a remedy which is a deep acting remedy. Don't tell me pimples, eruptions. Did you see something so superficial in creosote? It's a syphilitic and it's a deep acting remedy. So when I say skin, and when we are talking of creosote, even as a third year student, you should think of something big. Now what is that big you think of here? Yes, you can think of ulcers. Ulcers, very good. Ulcers which are not healing. Non-healing ulcers or ulcers which bleed on touch. Small touch, the ulcers start bleeding. Okay, non-healing ulcers. Ulcers which has that acrid offensive discharge, you can think of creosote. Okay, fine. And one thing that I have learned from my sir, my teacher, Dr. Vijaykrishna sir, is he says ulcers would have stopped, meaning as if it has cured, and suddenly it starts coming up. This is from his clinical experience. Okay, ulcers which almost cure and then suddenly they pop up. So you think it's all over and then again they come back. He says you can try creosote. Okay, so ulcers, one, very good. Anything similar of this depth that you can think of in creosote? Very good. Gangrene. Okay, gangrene. A very good remedy for gangrene. Gangrene of legs, gangrene of extremities, diabetic gangrene. Okay, gangrene again when you have all that foul smell. Okay, when there is burning, you can think of creosote. Gangrene. You will be studying in your surgery. And one simple thing that I expected from you is a remedy of hemorrhagic diathesis. Little injuries, bleed profusely. Good. Little injuries, bleed profusely. Can also be creosote. Done? Clear? Okay. Now the last part is cancer. Okay. Which cancer, which stage, what are all the symptoms of creosote is what we are going to explore in next 2-3 minutes. I told you under characteristic symptom, creosote is a very important remedy for cancer. First point. Okay. Now the next question is, where do we see cancer? Yes, good. CA stomach, CA cervix, CA uterus. Very good. CA nose. Stomach, we are done. CA nose. Okay. Vagina. Now what symptoms you have or which stage one thinks of creosote? Creosote is generally thought of in later stages. What do I mean by later stages? When you have more of ulcers, when you have more of ulcerations, those are that stages when we think of creosote. Okay. So ulcers or ulcerative state where you have that offensive discharge, blood, dark blood, clotted blood coming from the lesion. Okay. So offensive, acrid, corrosive discharges. See this last thing, so beautifully written, great debility. There is lot of weakness. And one last thing I have added from the repertory is cachexia. Cachexia is muscle wasting, weakness in late stages of cancer. You will be seeing person fully emaciated, loss of muscle waste, loss of weakness, lot of weakness. That is what we call it as cachexia. Any deep disease like cancer, like tuberculosis, like AIDS, they are capable of producing cachexia. In creosote, you have cachexia out of cancer or cachexia out of tuberculosis. Gangrene of lungs, we can think of creosote. Okay. So the last thing here will be the modalities. A typical modality that you have in creosote is 6 p.m. to 6 a.m. Aggravation 6 p.m. to 6 a.m. Cold food, coition aggravates. What happens when there is coition in creosote? Yes, good. There will be bleeding. Not necessary because of cancer. You know, one of the important signs of CS cervix is bleeding on coition. So it could be out of CS cervix, or it could be that the uterus is in a very fragile state, that it is bleeding. So bleeding after coition, bleeding from touch, or touch aggravates, predominantly a left-sided remedy. Many symptoms in an infant, in a child, will come up during dentition. Okay, and eating, lying, all aggravates. But two things you need to remember: you can urinate only while lying, and even menses will happen only while lying. Okay. Now what ameliorates? Warm food, pressure after sleep, and warmth in general. Warmth in general ameliorates. Okay. Now the last heading will be more of a futuristic learning. Whatever creosote I have told you or you have learnt, in practice tomorrow, where are you going to use, or which conditions you are going to use, is what we call it as the clinical utility of creosote. So this can be an open session. You can start contributing. Yeah. One second. I know. I should be afraid of asking open questions in this class. But I know. See, for a teacher, the kind of noise you are making in forms of answers that you are giving is a very nice thing. Fine? Good. So one thing is, as rightly said, see, you can go from head to toe, or you can have your own way of dealing with this. Cancer, agreed. Ulcers, what is it? Bedwetting, good. Gangrene, leukorrhea, lochia, cancer of many structures that we spoke of. Cancer mainly in which stage? Later stage, when there are ulcers, when there is that cachexia, malignant cachexia, there you can think of creosote. Okay, and one of the trios of offensive remedy, it could be simple as bad breath, dental caries, okay, septic conditions, septicemia, fine. GI, vomiting during pregnancy. What is it called? Very good. Hyperemesis gravidarum. You can think of creosote there. Yeah, any injury where there is more bleeding. Diarrhea, okay. Dentitional complaints. Sprains. We saw this here, that sprains aggravate. Must be have not written. In Fatak Materia Medica, Dr. Fatak mentions pains aggravate. You can have creosote there. Okay. So this is in short about creosote. Any quick questions? Anything you want me to repeat, or anything you would like to add? Yes. Okay. Yeah. Fine. So Chinmay has caught me in some area, and what is that area? Yes. Sir, you said creosote is a fast acting remedy. Okay. But in stomach we see there is vomiting which happens few hours after eating. See, now what you need to understand is, in GI, especially the stomach, the problem why they are vomiting so late is the digestion is getting slowed down. The digestion is getting, that is the only area where you see that is because of a pathology. You know, the stomach is going into indigestion, food is not getting digested, it is remaining in stomach long, and then they start vomiting. But when you look at the rapidity, what I was trying to tell you is cancer or anything, ulcer. 3 days back it was also fine and suddenly you have an ulcer, or you have seen an ulcer. From your experience you know it's going to take time, but next visit you see it is widespread. So that is what we mean by rapidity. Okay. So that rapidity is not seen in the stomach. In stomach the digestion is getting slowed. There is weak digestion. That's why the food is retained for a longer period. Done? Okay. Any more questions? Yes, yes, feel free, yeah. Yeah, see now, if you read therapeutics, of cancer, there are remedies which are beautifully described. For example, if you look at breast cancer, according to the stages mentioned by your surgery books, we have remedies indicated. Okay. So in the ulcerative stage or in the later stage, creosote gets in or fits in. But there are a lot of other remedies in homeopathy which has cancer symptoms, and it can be accordingly fit into the stages. But creosote is generally in later stage. We have asteria, we have other many remedies, okay, which can be accordingly we can fit in. Yeah, yeah. No, feel free, no issues. Whether I see, if I know I answer, if I don't know I tell I don't know. Feel free. Yeah, yeah. So what Chinmay wants to know is, you are done with the question or there is? Okay, okay. So now what is the question? Again a valid question for a third year student. Sir, people who are chronically ill, okay, they will have this feeling, let me end. Fine, let me end my life. See now this is a feeling, as a practitioner practicing for last 25 years, I don't see this common feeling with everybody. Okay, there are so many patients who even on their deathbed, they are so positive. Doctor, you give something, I'll be fine. Or there is something, you find out something. They might be sarcastic, they might start scolding you. Your science is so much advanced. I'm still lying on the bed for so many days. Why don't you do something? Bring me out. There are people who are of that sort also. Okay. But in creosote, what ideally you see is, they are so hopeless in that stage that they see death as the only reason or only solution. They will not commit suicide. There are people who commit suicide. There you can't think of creosote. Once they commit suicide, what are you going to do? It's all over. They are not committing suicide. They are not attempting suicide. It is only the thought, let me die, because there is no hope. That's why I purposely told creosote might bring him out of this state, but creosote will not cure his disease. Again, you will have to think of some remedy which will cover his pathology and you need to treat. Fine. Only that state might be cured, and it might give you some time to think of some other remedy. Fine. If he is a case of creosote, yes, he might improve. Now that case that I have shown you, he has cured of creosote now. I will have to give him some other remedy. I will have to give him his constitution. Just because creosote has helped him, I can't stop there. Fine? I will have to sit with him, try to understand his mind, body, and I will have to give him a constitution remedy. Okay. So here, creosote will act as a state. I didn't want to use the word state for a third year student, but it will act as a state remedy. Again, you will have to go back to your constitution remedy or whichever indicated remedy. Clear? Uduguru, anything behind? Yeah. Okay. See now, please be seated. Now see this question. If you see in creosote, it is not a very prominent symptom. If you look at the restlessness, it is not highly marked. Okay. But they are restless. That's what I wanted to tell you, because Majority of the carbons are slow, indolent, lazy people. So creosote is the only carbon which can be restless, first thing. And restlessness in creosote is not so much marked like your arsenic, like your aconite, or like your restox, like physical, mental. It is not all that marked. Fine, but they are restless and they feel better moving around. See, in the or under the mind, anger, fine, is there, shrieking is there, and dissatisfaction is there, capriciousness is there, marked. And very well marked is this last symptom. What is it? Death desires from despair. Highly marked and verified. When we see a restless child, at least I don't think of creosote. Because we think of arsenic, we think of aconite, phosphorus, some other remedy. What I want to conclude here related to your doubt is, it is not very much marked, but you should know. And I personally have not used it in my practice. To share, what is that restlessness you have in creosote? Okay? Any more? Yeah, good. Too many questions. Huh? Can you just be little loud and clear? Okay. So why do they shriek before and during stool? Okay, fine. Must be if you look at the abdomen. Could be because of some pathology in the abdomen. Must be some cramps. We didn't explore abdomen in detail. I skipped. We spoke of diarrhea. Must be understanding the abdominal symptoms can give us more clarity. The only reason that I can think of for time being in creosote is must be it is pain. Pain because of which they shriek before and during stool. Okay, could be pain. Anything else? Happy you came up with some questions. Thank you. I'll stop.